As COVID-19 shut down the Chinese city of Wuhan in January, the virus still seemed a distant threat for the US. On the 21st of January, the US had its first identified case, a man who'd travelled to Wuhan. 12 weeks later, the US has more than 400,000 confirmed cases, the highest number by far of any country. US President Donald Trump's public comments about COVID-19 also evolved during that time, from comparing it to the flu in early February.
A lot of people think that goes away in April with the heat, as the heat comes in,
to claiming in early March that COVID-19 wouldn't necessarily spread across the US.
We've done a good job by doing it and combating it so early. We have the best people in the world, and I think we're getting a lot of credit for having made that early move. So, no, I don't think that's inevitable at all. Yeah.
To addressing Americans later that same month about a national crisis.
I want to speak with you about our nation's unprecedented response to the coronavirus outbreak.
South Korea confirmed its first case on the exact same day as the US, rolling out a massive testing drive early on.
The US, however, was frozen at 500 tests total for over 3 weeks. And during that time, the epidemic, what we now know, was clearly spreading throughout the country during that time. And we had zero clue. It was happening under our nose. And by the time we finally realized the epidemic was happening, it was already in all 50 states.
South Korea's aggressive approach is credited with keeping numbers down. While cases in the US continue to climb, daily totals in South Korea peaked in late February. Giles Gibson, CGTN, Washington.